Welcome to our channel guys, Medical Mystery, solving the mystery for your exams. So I am NIRBHAY Singh Rathore, today dealing with the topic chicken pox, commonly known as varicella. So I am here giving you the nutshell of the chicken pox. So coming to its causative organism, it is caused by the varicella zoster virus, also known as human alpha herpes virus 3. Its incubation period is 14 to 16 days, that is around 2 weeks. Now coming to its mode of transmission, it will be transmitted via respiratory mode as you all know, and it might get transmitted through cutaneous lesions also. Now coming to its period of communicability. So rash appears in chicken pox. So the communicability is 2 days before the rash and 5 days after it. As I have written here, 2 days before the rash and 5 days after it. Now coming to its secondary attack rate. Secondary attack rate of chicken pox is around 90%. Then coming to its vaccine. Its vaccine is live attenuated vaccine, which is contraindicated in pregnancy. And the strain we are using for this vaccine is Oka strain. This is your Viva question or MCQ question. So now coming to the late complication. So the late complication of chicken pox is shingles, and it will occur due to the recrudescence of the chicken pox virus. So diving into the problem statement of the disease. So in developed countries, there are 3 deaths per 1 lakh of cases. Now coming to its epidemiological determinant. So it consists of agent factor, host factor and environmental factor. So in agent factor, the agent is varicella zoster virus. We have discussed it earlier. Source of infection is oropharyngeal secretion and lesion of skin and mucosa. Coming to its infectivity. So rash appears in chicken pox, so the communicability is 2 days before the rash and 5 days after it. Now the secondary attack rate, it is 90%. So now coming to the host factor. In host factor, children less than 10 years of age are more susceptible. Now to the immunity. So if the person is infected at once in a life, so the person will be getting durable immunity. That it is rare to get that infection of chicken pox again in his life. It's very rare. Coming to the pregnancy, infection occurs during pregnancy, so the infection will cross the placental barrier and it will increase the risk of fetus to contract the disease. Now coming to the environmental factor. So the disease will attain its peak during winter and spring mainly, and the virus is also a heat label that will also suggest that the peak will be attained in winter and spring. So now coming to the transmission. As we already know, the disease is transmitted via respiratory tract. So it is due to the droplet infection, and the portal of entry is upper respiratory tract and conjunctiva of the eye. This virus can cause infection to the fetus also, as it can cross placental barrier and it will lead to the congenital varicella. I have discussed this earlier. Now coming to the incubation period, that is around 2 weeks, around 14 to 16 days or 2 weeks. Now coming to the clinical features. Clinical features, there are 2 stages in this: pre-eruptive stage and eruptive stage. In pre-eruptive stage, we will see mild and moderate fever, then back pain, shivering or malaise. Coming to the eruptive stage, we will see the rashes in the eruptive stage. These rashes are pleomorphic in nature and centripetal in distribution, that is from trunk to the periphery. These rashes will spread from trunk to the periphery. Now coming to the complication of the disease. The complications are pneumonia, encephalitis, Reese syndrome and shingles. Shingles is the late complication of the chicken pox, which will occur due to recrudescence. Now laboratory diagnosis. This disease is mainly diagnosed clinically, but still will be diagnosed with the PCR. In PCR, we will be checking for the varicella zoster virus DNA. Then we can do the culture, cell culture from vesicular fluids. Then detection of IgM antibody in the serum. Now coming to the control. In control will be, first is notification. So there are many more diseases that should be notified to the higher authorities, and chicken pox is one of them. Second is isolation of the case. So we have to isolate the case for 6 days. It is important. We have to isolate the case for 6 days, which is after the onset of rashes. Then coming to the antivirus we will be using in this disease. Those are acyclovir and valciclovir. So let's come to the prevention of the disease. As you all know, the importance of prevention in community medicine. Here I will tell one more important thing, that is to share our video and subscribe to our YouTube channel. Now let's truly dive into the prevention of the disease. First of all, varicella zoster immunoglobulin. We have to give this immunoglobulin within 72 hours of exposure. Within 72 hours, that is almost 3 days. And we have to administer this IM intramuscularly, and the dose is 12.5 units per kg. 12.5 units per kg. Then we have to repeat this dose after 3 weeks. Now coming to the vaccine, which is the most important crucial part of the prevention. So in this disease, the vaccine is recommended for the children between 12 to 18 months. Now coming to the types of vaccine. Types of vaccine are two: monovalent vaccine and combination vaccine. In monovalent vaccine, the dose is 0.5 ml and it is given subcutaneously. Subcutaneously, it is important. Subcutaneously we have to administer it. The dose is 2 and we have to administer this vaccine about 13 years of age. The minimum interval between two doses are 4 weeks and maximum interval is 3 months between both the doses. Now coming to the combination of vaccine. So MMRV, measles, mumps, rubella and varicella. This is recommended to the 9 months of age till the 12 years of age. Then it is also given in 2 doses and the interval of this vaccine is minimally 6 weeks and 4 months. That is, first dose is given. After first dose, we have to administer second dose minimally 6 weeks after and maximally 4 months after. Then coming to the post-exposure prophylaxis. Post-exposure prophylaxis. So if a person is not immunized to varicella zoster infection, patient can be immunized within 5 days of appearance of rash. See, 5 days of appearance of rash, patient is unvaccinated and we have to administer varicella vaccine. So coming to the most important topic, that is differences between chickenpox and smallpox. As both the diseases are similar in nature, so it can be asked in your exam also. So on behalf of features, we'll be differentiating between chickenpox and smallpox. So on behalf of distribution of rashes, chickenpox is centripetal. The rash in the chickenpox will be centripetal in distribution, and in smallpox it's centrifugal in distribution. So what is centripetal? In this, the rash will appear first on the trunk and then to the other parts of body, that is limbs and face. And in centrifugal, the rash will appear on the limbs and faces and then come to the trunk. Then coming to the type of rash. In chickenpox, we'll be seeing pleomorphic rashes. That is, we'll be seeing multiple stages of the rashes like papule, nodule, like that. But in smallpox, we'll be seeing only one type of rash, that is non-pleomorphic rash. Only single type of rash will be seen. Now coming to the appearance of the rashes in chickenpox. So we'll be seeing dewdrop on rose petal. It's important, guys. Dewdrop on rose petal. This type of rash will be seen in chickenpox. This rash is superficial and unilocular in nature. Superficial and unilocular. And this rash will be more prominently seen in flexor part of the upper limb and in the evolution of the rashes in chickenpox is rapid and in smallpox it's slow evolution. Khamangani, thank you. That's all for today, guys. See you in the next video. Keep supporting.